Right now, tick activity is reaching its peak in Wisconsin. I recently spoke with Rebecca Osborn with the Wisconsin Department of Health Services about the state's tick monitoring efforts and bite prevention tips. Listen in.
So our tick population is pretty high every year. This is the time of year in June when we see the tick activity peak for the year. So we're seeing still some adult ticks out and some of these younger nymphal ticks out. And everybody's just had a lot of time to be out on the landscape looking for blood meals. Tick activity is reaching its highest of the season right around this time of year. So if you haven't already started thinking about ticks, now is absolutely the time to start.
And there is one tick in particular that you just talked about that really is the most prevalent type of tick right now. What is that? And unfortunately, this tick spreads more disease and illness, doesn't it?
Yes. So this is one of those situations where we have the same species of tick, which is called the deer tick or the black-legged tick. There's two phases of this tick. One is the adult phase and one is the nymphal tick phase. And right now we're seeing a peak in those nymphal ticks. These are those younger juvenile ticks. They are smaller, unfortunately, than the adults, about the size of a poppy seed, so very tiny. These ticks are able to bite humans and remain unnoticed and go attached for longer, so they're actually more responsible for spreading tick-borne disease than the adults. The adults spread tick-borne disease as well, but a larger proportion of these infections are spread by the nymphal tick stage because they're just so small and so difficult to find. So that's why they're a little bit more dangerous than the adult ticks are.
So we need to stay hyper vigilant to make sure that if we do get one of these ticks, that we remove it. And what should we do if we find one of these ticks?
Yeah, great question. You hit right on it. We do recommend that you remove the tick right away. The best way to do it is just to use a pair of fine-tipped tweezers if you have it. There are other tick removal tools that you can purchase at a drugstore or grocery store as well. Something that can grasp the tick very close to the skin. You can pull steady and slowly just directly out. There's no need to jerk or twist or yank. And that's the best way to remove a tick. If you don't have any tools with you, even fingers can work. You just want to grasp it as close to the skin as possible. And the quicker that you remove the tick, the lower the chances of transmission of any germ or disease will occur. So the quicker you remove the tick, the better.
And if we remove one of these ticks, we can actually submit it to your agency to find out what type of tick it was. Explain what this identification service is that you provide.
Yeah, sure. This is a tool where we request that people submit photographs of a tick that you've removed. This is something that our tick public health entomologist, who specializes in tick identification, can look at the photo and identify the tick species. So there are more than one tick species in Wisconsin. And there's several tick species that can bite humans frequently or pets frequently. But the one tick that we are most concerned about is the deer tick. And this is the one that spreads the large majority of all tick-borne illnesses, including Lyme disease and several others. So it can be helpful to know which tick bit you or bit a family member. So if you collect a tick and you're not sure what the species is, but you're interested in knowing, you can take a picture of that tick, submit it to our tick ID service, and we'll try and get back to you as soon as we can. Usually it takes a day or two to get a response.
That's a great service that you provide. Your agency is conducting bi-weekly sampling. You're doing this in a few counties in Wisconsin. What counties are those? And what all does it entail? It sounds like you do something called tick dragging.
Yeah, so we do this in 3 different sites in Wisconsin. They're selected so that they can be representative of the different habitats and locations in the state. So Iowa, Lincoln, and Waupaca counties are where our sites happen to be. There's nothing super special about these sites. It's just that, again, we're trying to pick different sites that represent the different types of habitats and ecologies in the state of Wisconsin. And we go out and drag for ticks through the vegetation. So we take this square cloth. It's not particularly, advanced technology, but take a cloth drag that's white in color so it's easy to see the ticks. drag it through the vegetation for a certain number of meters, stop at every so often at a standardized time frame, and count the numbers of ticks that are on the drag. We also collect those ticks for tick ID to identify the species, as well as for pathogen testing. So this is to test whether the tick was infected with a germ or bacteria, Lyme disease, for example, that could then go on to infect a human.
You also monitor emergency department data as well. This kind of gives you a full picture, right, of the tick situation and how many people are unfortunately maybe developing some illness or even Lyme disease.
Yeah, so this is one more tool that we can use to assess the risk of tick encounters, and of course that can predict tick-borne illness as well. So we look at the data that are sent to us are from emergency department visits for tick-associated visits. So it could be because of a tick bite, it could be someone who's sick, who was previously bitten by a tick, it could be for a tick removal itself. Any of those tick bite-related visits, we'll get some information on that and be able to track the overall proportion of visits that were associated with ticks. And this, again, just really helps us understand how many people are encountering ticks, how many people are seeking health care for tick bites, and it helps us communicate and understand better about when ticks are most active and when ticks are most likely biting people.
And all of this data, you post it right on the DHS website?
Yes, we do. We have a tick bite tracker, which is updated every week. And it shows, again, the proportion of tick bite visits in an emergency department. So this is a tool that people can look at. You know, if it's increasing and looks pretty high, that's just an indication that it's time to start using prevention measures. If you haven't already, think a lot about doing tick checks, and also, even if you haven't found a tick on you, if you start to feel sick during this time of year with flu-like symptoms, you know, fever, maybe a rash, it's important to go see a doctor and tell them that you could have been bitten by a tick, and to think about maybe certain testing or treatment.
So what are those treatments for tick bites? We'll discuss that and more after the break. Our conversation with Rebecca continues now as we talk about tick treatment for bites and actions you can take to prevent bites in the first place.
Thankfully, a lot of diseases can be treated with the same antibiotic called doxycycline. So this is a really nice tool for healthcare providers and for patients. If you are treated with doxycycline, if you're sick and the doctor is, maybe they're ordering testing, but they don't have the results yet, they can still treat you with doxycycline if they feel very, confident that it's probably a tick-borne disease. Especially if you have that bullseye rash, that's very classic of Lyme disease. A lot of times they won't even order testing; they'll just go ahead and treat you. There's a few exceptions that we do have in Wisconsin. There's two diseases: babesiosis. This is a parasitic disease that is also spread by the deer tick. It is not going to be treated by doxycycline. It has to have two other separate drugs. So that one's important for a doctor to do testing on, or if you have been treated with the antibiotic doxycycline and you're not feeling better very quickly, you might want to talk to your doctor about other testing to see if you might have babesiosis. And then there's another one called Powassan virus. This is very rare, but can be serious tick-borne disease. Because it's a virus, of course, it's not able to be treated by an antibiotic. And unfortunately, we don't have any antiviral drugs, for example, that can be used for that one. But without other than that, those two diseases, everything else can be treated with doxycycline. So that's really useful.
And it's important to get that treatment earlier than later, because these diseases can progress to cause some pretty serious complications.
Absolutely. So the earlier the treatment, the better. This doesn't mean that it's important to be treated right after a tick bite. So this can be some confusion, which is very understandable. If you do have a tick bite, but you're still feeling well, we don't usually recommend that you be treated, especially with a full course of antibiotics. What we're really hoping people think about is, are you feeling sick? Do you have fever? Do you have body aches? Do you feel ill, like you might have the flu? But it's summertime and you might have been in tick habitat, or you've had a tick bite. That's when you need to see your doctor and hopefully get diagnosed with, if it's a tick-borne illness, if it's appropriate to be treated with doxycycline. So there is an important distinction there. Some people aren't sure if they should get medicine right after a tick bite, or, really it's just if you start to get sick. The only other thing is that if you get bitten by a deer tick and it's engorged with blood, that means it's kind of starting to fill up with blood. That means it's been attached for probably at least 24 hours, maybe longer. And in that case, we do recommend that people talk to their doctor about what's called a prophylaxis dose. So this is a prevention for Lyme disease, and it's just a single dose of doxycycline that's really only recommended for those really high-risk tick bites when the tick has been attached for a long time.
We want to prevent ticks at all costs. We don't want to have to end up going on these antibiotics and having the worry. What do you recommend people do to prevent those tick bites in the first place?
Yes, prevention is best, of course. Sometimes, like I mentioned before, it's not so easy to just get an antibiotic and then, feel well. So the best thing to do is to prevent bites in the first place. So we recommend using repellents. That's an EPA registered repellent. These are ones that have been tested for both safety and efficacy. Things like DEET, picaridin. There's one called oil of lemon eucalyptus. There's a few others that are EPA registered that are really useful and can last for several hours. If you aren't really a fan of repellents and you're not willing to use them, which I agree that they're not always fun to spray on your skin, we do recommend that you consider permethrin. This is something that you spray on your clothing or your gear, and it becomes embedded in the clothing and can both deter the ticks from finding you, and also if they do crawl on your clothing, it will actually kill them eventually. It's not going to be immediate, but after a few minutes, they'll get a dose of that chemical and they will die. So permethrin is a great one to use if you're not really looking for something to put on your skin. But the repellents are safe and effective, as well as permethrin if you use it on your clothing. The other things we recommend for prevention are just trying to stay out of tick habitat as best you can, so that, like, if you're going for a hike, try to stay on the trail and not go off the trail into the vegetation. Sometimes that's not possible, though, so if you've been walking through tall grass or vegetation, that's certainly a time to do a tick check. So tick checks are great to try and find any ticks that might have crawled on you, or to look for any bites. We recommend doing those at least daily, if not more often if you can, if you think you've been out in tick habitat. And then there's a few others, like taking a shower after coming indoors. You can put your clothes in the dryer on high heat, and that will kill ticks if they're on your clothing. And then, of course, using a pet tick prevention. If you have pets, especially if they go indoors and outdoors, they can bring ticks into your home. So it's important to talk to your veterinarian about tick prevention on your pets.
All right, this is all great information, Rebecca. I appreciate you sharing that with our viewers. Any last thoughts before we end this conversation?
Just a reminder that ticks are going to be active for the rest of the summer, and they can even remain active into the fall. The adults will come back in those fall months, kind of September, October, and even November. And even if we get warm days in the winter, unfortunately, ticks can come out again. So ticks are active anytime temperatures are above 40 degrees. So just kind of file that away in the back of your head. And anytime it's warm, even if it feels chilly and we're putting on layers, the ticks can be active. So keep that in mind through the summer and into the fall.
Fantastic.
And our thanks to Rebecca for the conversation. We'll be right back after this.